The musculoskeletal system provides support to the body and gives humans the ability to move. The body's bones are the skeletal system, muscles, the muscular system, cartilage, tendons, ligaments, joints, and other connective tissue comprise the musculoskeletal system. Upon completion of this presentation, you will be able to identify primary root words, prefixes, and suffixes, and use word-building skills to construct medical terms related to the musculoskeletal system. You will be able to identify the top diagnoses related to the musculoskeletal system. You will be able to identify procedures that apply to the musculoskeletal system. You will be able to identify diagnostic tests related to the musculoskeletal system. And finally, you will be able to demonstrate your knowledge of the material by successfully completing an evaluation. Now we will go through common root words, prefixes, and suffixes associated with the muscular system. Let's put together the root words, prefixes, and suffixes to create some commonly used medical terms in the muscular system. Fascioplasty is the surgical repair of fascia. Fibroma is a tumor of fibrous tissue. Muscular means pertaining to the muscles. Myorexis is the rupture of a muscle. Tenotomy is the incision of a tendon. Tendoplasty is the surgical repair of a tendon. Tendinitis is the inflammation of a tendon. Quadriplegia is paralysis of all four extremities. Hemiplegia is paralysis of half the body. We will now go through the root words, prefixes, and suffixes of the skeletal system. Once again, let's put together the root words, prefixes, and suffixes to create commonly used medical terms of the skeletal system. Craniotomy is an incision through the cranium. Osteoporosis means porous bones. Spondylitis is inflammation of any of the vertebrae, usually characterized by stiffness and pain. Arthrodesis is surgical immobilization of a joint. Costochondritis is inflammation of cartilage of the ribs. Orthopedics is a branch of medicine concerned with prevention and correction of musculoskeletal system disorders. Hypocalcemia is a deficiency of calcium in the blood. Periosteum is the structure around the bone. We will now go through the top 10 diagnoses of the musculoskeletal system. Cerebral palsy is a very common congenital disorder that affects a person's posture, balance, and motor functions. Although cerebral palsy affects muscle movement, it isn't caused by problems in the muscles or nerves. It is caused by abnormalities in the parts of the brain that control muscle movements. The most common signs of cerebral palsy are lack of muscle coordination when performing voluntary movements and stiff or tight muscles and exaggerated reflexes. Walking with one foot or leg dragging, or walking on toes, a crouched gait, or a scissored gait. There is no cure, but treatment will often improve a child's capabilities. In general, the earlier treatment begins, the better chance children have of overcoming developmental disabilities. There are different types of cerebral palsy. Monoplegia affects one limb, usually an arm. Hemiplegia affects one side of the body. Diplegia affects either both arms or both legs, and quadriplegia affects all four limbs of the body. Fibromyalgia is a chronic and debilitating muscle disorder. It causes pain, fatigue, tenderness, and stiffness of muscles. It is considered a genetic disorder and affects more women than men. Researchers believe that fibromyalgia amplifies painful sensations by affecting the way your brain processes pain signals. While there is no cure, a variety of medications can help control symptoms. Exercise, relaxation, and stress reduction measures also may help. Myofascial pain syndrome is a chronic pain disorder of the muscles. It causes aching and burning sensation on trigger points, which are sensitive spots of muscles. It can cause joint stiffness, knots in the muscles, and sleeplessness due to pain. This can be managed by corticosteroids, injections of botulinum, massage, and physiotherapy. The shoulder muscles help in rotating the shoulder as well as move the hand in front and back. The structural strength for this joint is due to the tendons of these muscles. Rigorous, fast, or hard movements can cause a tear in the tendon, which causes pain and reduced mobility. Torn tendon can be repaired by surgery. Twist or pull in the muscles or tendons, which can either be sudden or over a period of time, may cause sprains and strains. Back and hamstring muscles are commonly affected. This is one of the muscular system diseases that cause pain, swelling, and difficulty in movement. Rest and ice compress are advised, and it is important to keep the area immobile and take medicine for the pain. Arthritis exists in two main forms: osteoarthritis and autoimmune arthritis. Osteoarthritis is the wear and tear bones experience over time. All joints are lined with cartilage to provide cushioning and synovial fluid to help lubricate the joint through range of motion. Over time, these tissues break down and wear away, leading to bone spur formation, joint narrowing, inflammation, and pain. Severe osteoarthritis management consists of pain control, and at times steroid joint injections can provide temporary relief. Advanced cases are treated with joint replacement. Autoimmune arthritis occurs when the body attacks itself and damages joints. Rheumatoid arthritis is an example of an autoimmune arthritis. Over time, this arthritis results in severe joint destruction and chronic debilitation. Treatments are geared towards managing pain and modulating the immune system to limit further destruction. Osteoporosis causes bones to become weak and brittle. It occurs when the creation of new bone does not keep up with the removal of old bone. Osteoporosis-related fractures most commonly occur in the hip, wrist, or spine. Medications, healthy diet, and weight-bearing exercise can help prevent bone loss or strengthen already weak bones. Overuse or injury of the tendons results in inflammation and pain. Tendons connect muscle to bone and facilitate movement. Paget's disease leads to abnormal breakdown of bone tissue in specific areas. This is followed by abnormal bone formation. The new area of the bone is larger but weaker. Not all people with Paget's disease need to be treated. Drug treatment helps prevent further bone breakdown and formation. Currently, there are several classes of drugs used to treat this disease. The bursa are specialized sacs of fluid found around our joints. They provide cushioning between the joints and nearby muscle, tendon, and ligaments. This condition causes pain, swelling, and mild redness. Treatment includes avoiding pressure on the area, over-the-counter medication such as ibuprofen, and rest. We will now go through the top 5 diagnostic tests of the musculoskeletal system. X-rays are done to identify and evaluate bone density and structure. Injection of contrast medium with an accompanying X-ray may be done to visualize joint structures. A CT scan provides a three-dimensional picture used to evaluate musculoskeletal trauma and bony abnormalities. An MRI is used in diagnosis and evaluation of tumors, disc abnormalities, and tears in ligament or cartilage. It uses radio waves and magnetic fields. A bone scan is a nuclear scan of bone tissue to detect a tumor, malignancy, or other abnormality. An EMG is a neurodiagnostic graphic record of the electrical activity of muscle both at rest and during contraction. It is used to diagnose neuromuscular skeletal disorders. We will now go through the top 5 procedures of the musculoskeletal system. An arthroscopy is an endoscopic examination of the interior surfaces of a joint used to perform surgery and diagnose diseases. An amputation is a partial or complete removal of a limb for a variety of reasons, including tumors, gangrene, intractable pain, crushing injury, or uncontrollable infection. A bone graft is a piece of bone taken from the patient used to take the place of a removed bone or bony defect at another site. A carpal tunnel release is the surgical cutting of the ligament in the wrist to relieve nerve pressure caused by carpal tunnel syndrome, which can result from repetitive motion, such as typing. Tendodesis is a surgical procedure to stabilize a joint by anchoring down the tendons of the muscles that move the joint. Now that we have completed the presentation, we will take a few moments to evaluate what we have learned. Which of the following terms means bone? That's right, the correct answer is B, osteo. What is a very common congenital disorder that affects a person's posture, balance, and motor functions? You got it, the correct answer is C, cerebral palsy. Which of the following terms means structure around the bone? That's it, the correct answer is D, periosteum. This completes the learning module on the musculoskeletal system. Thank you so much for your time and attention.